Ooh, I love seeing where everybody is coming from. Some folks from Michigan, California, Alaska, Idaho, some of my coworkers here at MIWSAC. And yeah, so please keep continuing to chat in, where you're from, if there's anything in particular that you'd like to make sure we kind of talk about today or that we're kind of aware of. And so we are really excited about this opportunity and this space and this time that we're going to be able to have together today. This space serves a few different purposes, which includes an introduction to the various sexual assault resource centers. We'll also have a little bit of like a Sexual Violence 101 that I'll be delivering, as well as at the end, which I'm really hoping can be a good and robust conversation where we are able to have a listening session with you all. And we can hear what is happening within your programs, where you're seeing as emerging needs, gaps, and especially ways that we as the resource centers and as TA providers are better able to help you and the communities that you serve within. I see more folks from New Mexico, DC, Washington, Montana. All right, well, I think just for us to get started, we are going to be sharing a video today as kind of a welcome introduction to this space. So I'll need to switch my share, so please. All right. And here we go. Continue to chat in as we watch this video.
Good afternoon and welcome. I am Shondell Dawson, the director of the new Office on Family Violence Prevention and Services, and I'm so pleased to welcome you to this Sexual Assault Training and Technical Assistance kickoff meeting. The Family Violence Prevention and Services Act American Rescue Plan Sexual Assault Supplemental Funding that was awarded in 2021 was intended to assist rape crisis centers and sexual assault programs in providing services, ensuring the continuity of services, and meeting the needs of sexual assault survivors. We are grateful that Congress provided us with the appropriation that we could allocate to states and territories so that they could issue subawards to rape crisis centers all across the country, and also partner with sexual assault coalitions and sexual assault organizations to provide training and technical assistance. We're also grateful to have allocated funding to 252 tribes to support sexual assault services for American Indians and Alaska Natives, as well as to partner with the tribal coalitions for training and technical assistance. The intended purpose of these funds are to support virtual, remote, teletherapy, telehealth services, ensure the continuity of crisis services and the assistance to be able to meet all the basic needs that sexual assault survivors have, provide supportive services, including housing assistance, healing and well-being supports, health and behavioral supports, as well as addressing any other emergent needs or safety concerns that survivors may have as it results to the COVID-19 public health emergency, as well as their overall survival of their lived experiences with sexual assault. Our intended outcomes are to ensure that there is safe voluntary access, both remotely, virtually, as well as in person for sexual assault services, to support meaningful partnerships between sexual assault organizations and healthcare providers and behavioral health providers, increase the usage of mobile advocacy services to be able to meet survivors' needs no matter where they are located in community, increase access to both health and well-being and behavioral health supports for survivors and their children, and ensure that there is enhanced supportive services available for survivors no matter where they are located in each state and U.S. territory. There are endless possibilities for implementing these funds, from increasing health and well-being supports, increasing access to teletherapy and telehealth services in rural communities, partnering with healthcare providers to be able to make rounds and visit sexual assault survivors located in programs or sheltered throughout community, extending partnerships to hotel motels to be able to support sexual assault survivors and having access to safe housing, as well as the increased use of mobile advocacy services, as well as increasing the investments in tribal specific services, as well as culturally specific sexual assault services for survivors. The training and technical assistance kickoff webinar that you all are participating in today is intended to help you all achieve the implementation of a broad base of comprehensive services for sexual assault survivors. We are very proud to be supporting culture-specific sexual assault capacity building centers, whom you will hear from today, as well as partnering with the National Alliance to End Sexual Violence around training and technical assistance. These resources are intended to be important thought partners for you all, resources and support to provide guidance, to help provide brainstorming, so that you all have the resources and support you need to support the implementation of the American Rescue Plan Sexual Assault Supplemental Funds and continue to be able to meet the needs of sexual assault survivors. So I'm grateful for you joining us today, and I am looking forward to learning about how you all are implementing sexual assault supplemental funding in your communities and how you all are partnering with the new sexual assault technical assistance providers that are funded by the FVPSA program to be able to meet those needs. Thank you again for joining us, and I can't wait to hear more about your important work. Have a good day.
So glad we were able to have that video. Shondell giving us a little welcoming to our space today as well. All right, and so now we're going to be talking a little bit more. So as Shondell had mentioned, you know, we have a variety of amazing resource centers that are really here to really support communities as they increase and enhance their ability to provide services to survivors of sexual violence and to really make change, you know, within their individual communities. And for those who have just joined us, please continue to chat in, you know, where you are from as well. And we'd love to kind of see that. I will say, when I heard 252 tribal nations that are funded, I just find that to be just incredibly beautiful. The fact that all of us are able to really be kind of focusing in on just something that's such a great need within our tribal communities, it's very exciting. And so we're really looking forward to this space together. And so as you can see kind of on this slide, these are the folks that we have. And we'll each be doing introductions of our programs, and I will start out first. And now this is when I'm actually going to introduce who I am. And so, bonjour, welcome everyone. My name is Jolene Engelking. I am White Earth Anishinaabe from Minnesota. I am an advocate at heart. I am a mother, a daughter. I am a theater lover, somebody who wants to be a runner someday, all of these different things that make me who I am. And today I'm here on behalf of what I consider the amazing organization that I work for, which is the Minnesota Indian Women's Sexual Assault Coalition. I do not know how that got in there. We are not the Minnesota Indian Women's Resource Center. We are the Minnesota Indian Women's Sexual Assault Coalition. And I do not know how that was missed. But we are a state, as many folks know of MIWSAC, as we are a statewide tribal sexual assault coalition here in Minnesota. And so our membership is made up of the 11 federally recognized tribes in Minnesota, as well as all of the different allies and organizations and people and survivors who really want to do better for our survivors in Minnesota, and to really collectively think about how can we implement change in our communities, in our tribal communities, and at the various levels. And so over the last 10 years or so, MIWSAC has really grown from our little grassroots coalition to now being a staff of 17, and with most of that work really focusing on our national training and technical assistance. Within the group, you'll also see a couple of our other TA providers from my colleagues who work with the TSASP grantees who are funded under OVW. And so we have our TA provider program that supports those grantees, as well as, working in sex trafficking, both in broadly as well as within urban communities. But we are so excited about this new opportunity through the FVPSA office to be able to have this resource center. And so currently we're calling it the National Tribal Sexual Assault Resource Center, where we're really going to be focusing on growing our resources that we have. And that may be, handouts, samples, videos, anything that will help both funders and on-the-ground service providers do better and feel more supported as they do this work with communities, with survivors. And so we'll be offering virtual and in-person trainings. I know that we've already kicked off our first one with a webinar, and we'll be having a couple more coming up in April and moving forward that will both be broad, but we'll also definitely be willing and able to work with individual communities or regions to be thinking about how can we better meet needs that are out there. One of the things that MIWSAC is grounded in is hearing from the voices of survivors, being led by the voices of survivors, as well as being led by the voices of communities as we develop these tribally specific ways of being. So we want to increase the knowledge both within tribal communities, as well as in urban communities, rural communities, hub communities that are all serving Indigenous survivors. And that includes folks who, may not be enrolled for a variety of reasons. And so we want to make sure that we are kind of staying attuned and learning from folks. And we're also excited to be, doing more of that systems and social change work that I think is so important within our communities. And so for this coming year, we're focusing in on things like today, which are the listening sessions, webinars, trainings, and developing and having site visits, and also really thinking about how we can do better with survivor engagement within each of our communities. And so I will just turn it over briefly to my colleague, Becky, who will be joining me in the presentation here in a little bit, just to do a brief introduction of herself, though. I might have chosen the 1 minute when Becky stepped away. And so she will introduce herself when she comes on, and I will turn it on over to the folks from the Alliance.
I am here, Jolene. I was muted. I turned on my camera, but not my microphone. So sorry. Good to meet you all. My name is Becky Jordan. I'm the Communications and Design Specialist here at MIWSAC. Very happy to be here. Thrilled to be part of this project. Super excited to hear from all of you today and share more about our work and hear about the work that you're doing in communities. I am currently living here in South Dakota and have many, many ties to Minnesota and other folks across the region and area, and have a history of working in sexual assault and domestic violence advocacy, as well as sex trafficking work and direct services as well. So good to meet you all and be in space with you today. Looking forward to it.
Thank you, Becky. And yeah, now we'll have each of the other resource centers do an introduction of the great and amazing work they're doing. Maureen?
Thank you, Jolene. Thank you, everyone, for joining us today. It's a pleasure to be here. My name is Maureen Gallagher, and I am the Advocacy Coordinator at the National Alliance to End Sexual Violence, which you'll also hear referred to as the Alliance. We are the voice in Washington for the 56 state and territorial sexual assault coalitions and more than 1,500 rape crisis centers working to end sexual assault and support survivors. And by that, I mean we have an arm of our organization that is very much advocating for things such as FVPSA, sexual assault, ARPA dollars, also VOCA, VAWA, and many of the other funding sources. And we're really excited to expand this work and also do training and technical assistance, which we've done for years with Sexual Assault Coalition. We have longstanding relationships with all of the state and territorial sexual assault coalitions. We communicate with them regularly. We have webinars, we have listservs, And we're hearing from them about their emerging issues and what's happening on the ground through them and through the rape crisis centers that are members of their coalitions. And in our technical assistance work, we are, responding to different kinds of organizations, what they need to meet sexual assault survivors' needs. And that includes, as I said, local rape crisis centers and sexual assault programs, also includes the coalitions, of course, the funders, administrators, allied professionals. And so with this project, we're excited to, similar to what Jolene said, is to be kicking off this work with listening sessions such as today, also listening sessions with like FVPSA administrators, sexual assault coalitions, really to guide future webinars, any written materials that would be helpful to folks, in-person convenings. We're going to be launching some office hours collectively at the end of April, and then also available for one-on-one consulting as needed. We are just really excited to be in partnership with the culturally specific sexual assault capacity building centers, and we are very pleased to be in collaboration with and support any needs that we can with the tribal grantees as well. So looking forward to hearing from you today about your work. And thank you. And I will turn it next to Norma.
Thank you, Maureen. My name is Norma Ferraro. I'm from Mujeres Latinas en Acción, and I'm the Director of Technical Assistance. So a little bit about me, she, identify as she, he, ella, and I'm an immigrant, and I was born in Peru. So Mujeres Latinas en Acción, Latin Women in Action, is the longest standing Latina-led organization in the country. Mujeres has had the honor to support the Latinx community for 50 years. Mujeres is a statewide nonprofit organization located in Illinois, and the national training and technical assistance provider for the response and prevention of sexual assault in the Latinx community. And we are very grateful for this funding because we are going to be able to really support these communities that haven't had support in a meaningful way until now with the resource center. So we are really, really grateful. Our approach is focused on developing roadmaps with community organizations based on their values and strengths. And through our resource center, we offer a wide range of activities to support our mission. These include resource development and dissemination for the response and prevention of sexual violence, virtual webinars, community-based work, resource library development, training and technical assistance, and conducting research and evaluation. For the fiscal year 2023, we are excited to be focusing on listening sessions, site visits, webinars, and the development of our online library. These activities are going to help us to better understand the needs of our communities we serve and provide vital resources and support for those who need it the most. Thank you, and now I pass it to Mira.
Hello, everyone. My name is Mira Yusuf. I am the Executive Director of Monsoon Asians and Pacific Islanders in Solidarity, which is the main organization holding the NAPISAV, or the National Organization of API Ending Sexual Violence. I am Filipina. I am an immigrant to this land. And also, I just want to introduce Nina Yusuf, which is also is the director of the program director of NAPISAV. Nina, do you want to just say hi?
Hi, hello everyone. I'm Nina Yusuf. I am from Indonesia, immigrated here in 1986, and I'm based in California. Thank you, Mira.
And I immigrated to this land in 1983, and I'm based in Iowa. So just quick information about our organization. We are basically we provide training and technical assistance to API, or Asians and Pacific Islander led organizations nationally, and also in the US territories in the Pacific, and also mainstream organizations in improving their services to SA or sexual assault victims and survivors who are from the API communities or who identify as API. Our resource center specific is listed here. I don't want to read them. Also, I just want to share that NAPISAV was established in 2011 to specifically focus on sexual assault because there were a growing concern among advocates, API advocates, about the lack of services for API survivors of sexual violence. So that's why it was created. Also for this year, and we are just really, really happy to have this funding to be in sisterhood or in relativehood with our other, with the other culturally specific resource centers. So we are very excited about this because currently, before the HHS funding, we were funded by the Office on Violence Against Women. So this year, we are really focusing on a national community assessment because this is our way of community building or relationship building with the different communities that we will basically serve. So yes, it's right there where we're going to be, and we're just really busy in that. But any questions about our organization or the work that we do, please contact us. So next one, I think, is Condencia from CISE.
Thank you, Mira. Can you hear me?
Yes, we can.
Great. Thank you. Thank you. I'm having to dial in, folks, because my internet is constantly going out. My name is Condencia Braid, and I am with the National Organization of Sisters of Color Ending Sexual Assault, CISE. And we are a national culture civic organization that really works on addressing sexual assault across all communities of color, culture civic communities. And one of the things that we also do is we have been working in partnership with UJIMA, the National Center on Violence Against Women in the Black community, to develop and increase access for survivors of sexual assault from the Black community. It is in that sisterhood and partnership that we are serving as the National Resource Center addressing sexual assault within the Black community. We are very privileged to have the Resource Center. We actually, in terms of tribal nations, we have done some work with tribal nations because we serve as a sexual assault culture-specific technical assistance provider. And in that, we have worked with a number of tribes and other Native communities addressing throughout the U.S. and addressing sexual assault. So I'm so excited that we're all able to have this funding. A lot of the work that we will be doing as a part of the Resource Center, specifically in the Black community, is we will be, as many of our colleagues will be doing a national listening session as well. To Mira's point, one of the things is that, we have not oftentimes have this intentional pot of funding that allows us to begin to look at the broad impact of sexual assault in our communities. And so we're very excited to be able to address the public health concerns that survivors often have, and looking at those intersections and really hearing from the Black community, how does sexual assault show up and what do we need to do to heal and address and prevent. We'll also be looking at some of the implications related to having a history of trauma. And so for the Black community, we have histories of historical trauma and what that has meant to the continued trauma that we have to deal with on a regular basis, and then layered on top of sexual assault. So we will be focusing some work on looking at somatic and somatics and how do we address and respond to somatic trauma and its impact on Black women and girls. And then also looking at how do we support the leadership of the Black community to continue to respond to sexual assault effectively. And so we'll be looking at that as well. So again, not to take too much time, but really excited to be doing this, really excited to be in partnership with my colleagues on the webinar as we respond to sexual assault across all of our communities. Thank you, and I am turning it back over to Mira.
No, Condencia, it's back
Mira?
to Jolene. It's
Okay.
back to Jolene.
Oh, back to Jolene. Oh my goodness, I'm so sorry. I went right back to yesterday. Sorry about that, Jolene. That's my bad. Back to Jolene.
No, I love it. I feel that I can also listen to you and Mira talk all day long as well. I did just want to put this slide in here, which includes all of our contact information. This will all be sent out afterwards, but just so you have that understanding, and so you can kind of know that it's there. And so we all want to be able to, act as resources to each of you. And I think especially when we're thinking about the intersectional identities that come with being Native, especially and even with as sovereign nations, thinking about the fact that often we have multiple parts that make up who we are, and that folks are often multiracial or multicultural. And so just really thinking about how are we best able to truly meet all the needs of our communities. And so yeah, now we'll start to do the little 101 training to really kind of help to ground us, which I hope will act as a good baseline for when we have the listening session component later on. And right now, within the chat, if you could chat in, what was I going to say? If you could chat in, how comfortable do you feel providing sexual assault services within your community? Is it brand new to you? Is it something that you've been doing forever and this is just kind of old hat, if that's the correct phrase? Or is it something that you are really growing and learning within? So if you could just chat in kind of like, what is that level of, comfortability with providing sexual violence or sexual assault services? Thank you. All right. And so we just kind of want to start out with this idea and conversation about, what does sexual violence look like in tribal communities? And I think that is something that is a big and a vast question. And I think that many or most of us know that sometimes sexual violence can feel palpable within our small reservations, large reservations, just within our communities and within our families. There are certain things that that we know that sexual violence acts within that big spectrum, that we are talking about everything from the sexual harassment that can happen within workplaces, to the things that are happening within our families that we don't often talk about, to sexual violence that's inflicted upon our Indigenous relatives by folks who are coming in, from off of the reservation. There's so many different ways that this is looking like. And so I'll read some of the ones in chat. That learning and growing, which I think we all want to be doing. I feel that even if we've been doing this work, I've been an advocate now for 18 years, and I still feel that I am always learning and always growing. And there's always so many things, especially with the changing dynamics, changing laws, changing ways of thinking. Continue learning and growing, new and starting to build foundation, new to providing services, but appreciative of learning experiences, new, challenging, mistrust, and misunderstanding. Yes. And so, all right. And so this is some of the things that we know. So we know that, more Native women experience rape than any other ethnic group. Why is that? And there's no way within this 30-minute training that we can talk about, all of the impact that stemming from contact, about why Native people, particularly Native women, are at that higher risk. But there's this dehumanization, there's this invisibility that comes with within our Indigenous communities that I think is really hard to talk about. When we think about the fact that jurisdictional complications also add to this quagmire. Just speaking from Minnesota, where when my first paid job as an advocate, we were a hub community, an area where we had 3 reservations that really kind of like abutted where we worked at, and 2 of those were under Public Law 280, and 1 was non-Public Law 280. And so we're dealing with 7 counties, as well as 3 tribes, as well as concurrent jurisdiction with the state, and then concurrent jurisdiction with the federal government. And it was confusing enough for us as advocates, let alone for survivors, and really thinking about how, depending on wherever, you know, an assault happened, it could greatly vary the response that they were given and whether or not they were even believed by certain responders, as well as what is the likelihood of achieving any sort of justice, if that's how folks wanted to define justice. And so I think that when we're adding in all these complications, oh yeah, a lot of, somebody made a comment that a lot of the sexual assault on our reservation was taught from the boarding schools and continued to plague our community at high levels. Mostly we see incest, molestation, and drugging and raping at parties. And I think that is incredibly true. Most of us have folks who in our family who, you know, attended boarding school. And when we think about the level of severing that happened from the boarding schools, both in connection to self, in connection to culture, in connection to the way that we're able to raise our families. It's just a very small thing, but to this day, my grandma attended boarding school, and her grandma came out of boarding school and had 16 or 17 live births. And we're thinking about how somebody, and she was unable to process the trauma, you know, that she had, and that fell down into how she raised her own children. And my mom, who loves me unconditionally, has only said she's loved me once in all of my 36 years of life. And that is a direct result of boarding school. And that's just a very small thing. But at the same point, I think it's just really indicative of the fact that, like, this is permeating and impacting us today, and even in a greater way, especially within the smaller and more remote tribal communities, where the impact of the boarding schools and the legality of our ceremonies and our religions, how that impact is still there. And there are so many communities doing great work with revitalization and all the beautiful things that come with both language, ceremony, healing, returning to culture, all of those things. And the impact is still there. And we're also talking about, you know, that most rapes go unreported. And why is that? And that is often because, I mean, even I think people mentioned within the chat, you know, if there's things happening within our own families, a lot of us have been taught silence, right? And that's not unique necessarily to tribal communities, but it is extra amplified within our spaces. And so there's both this silence and shame that comes with things, but also with folks who, I mean, if we're talking about impact of, you know, forced sterilization and other things that happened to us when we went into even medical facilities, there's this level of mistrust to going to reporting. Even seeking out like a medical forensic exam can be really difficult for some folks, right? We're also talking about how within our communities, people don't report because small communities, there is concerns about confidentiality. There's concerns about, like, I walk into the IHS up north, and, you know, I'll generally see at least one, if not, I think the most is 7 of my family members. And that's not even our home reservation, right? And so really just thinking about, that's one of the reasons why, even with HIPAA, even with all these other laws that are really helping to guide and supposedly support us within confidentiality, it's still hard. And then that's not even talking about the level of mistrust that comes with lower arrest rates, low prosecution rates when it comes to sexual assault, as well as mistrust of those sorts of systems in particular, as well as that jurisdictional quagmire that we already talked about. And then, yes, and of those reported, most are raped by non-Native men. And these are things that we keep finding in stats, and we're talking about how statistics, I thought I had a next slide about statistics, but how often we're viewed as significantly or statistically insignificant, and how there's a lot of reports out there. So we'll see these numbers that float out there. And if you reach out, we can send you all the various numbers that we can sort of find, where it's saying anywhere from, 40 to 90% of Native women have been sexually assaulted, where I've seen anywhere from, 10% to 50% of our Native men. And then also our Native LGBTQ and Two-Spirit relatives are also at a disproportionately higher rate of violence done to them. But the studies are so limited sometimes. They are focused on one community or one demographic. And because of, we're just often not linked within different spaces. I got distracted there. One of the other things we really want to talk about is this difference between sexual assault and domestic violence. And I think that that is really important to note and to talk about. And that's one of the main reasons why we're here today. We are so excited about being the Tribal Sexual Assault Resource Center, in large part because sexual violence is still often not talked about and is underfunded within so many spaces. And even within communities where there is funding to provide for both, often domestic violence is what takes precedent. I did a training for one tribal coalition, and I think we had about, 7 different tribal nations represented. And it was solely focused on sexual assault. And it was very difficult to keep turning it back because everyone wanted to only talk about domestic violence. And I kept having to try to loop it back to sexual violence. And finally, someone was like, we aren't seeing people come forward talking about sexual assault. And so even within these communities where they know and they're aware that sexual violence is happening constantly within their community, people still weren't coming forward to the advocacy programs. And so it was so much easier for them to be like thinking and framing everything in terms of domestic violence, because that's what they're seeing. That is when the crises were happening, where they need housing. And for some of them, it was easier for them. And so we're thinking about this level of comfort in addressing these issues. And for one thing, sexual assault funding in many spaces is relatively newer compared to domestic violence. And there's also people who, there's this true conflation of the issues. I was told at one point that all sexual assault is domestic violence. And I don't believe that to be true. Well, there is often and can often be sexual violence that happens within intimate partner sexual assault or intimate partner violence. Not all sexual assault has that same underpinning. And there's also multiple reasons when we're thinking about the whys of sexual assault. And so often when we're talking about, domestic violence, we talk about the power and control wheel, which is something that, I used to work for an organization that was founded by one of the people who created the power and control wheel. And I became very, very versed in that. And well, in some ways that is still highly relevant within sexual violence. When you're thinking about those levels of power and control that are exerted, there are also still many other ways and reasons and that are the root cause of sexual violence within our communities. And also one of the things that we really need to be thinking about is, those how difficult it is for some folks who within our communities, particularly sometimes within tribal communities, it is so hard to talk about healthy sexuality and about the body, about anatomy, and about those things that are private and personal. And as we talked about a little bit before, this ability that we have been told to keep things very, very private at times. And so when these acts of violence are done to our bodies, to our spirits, it can be incredibly hard to talk about. Especially if it is intergenerational trauma that is happening, where families may not, if a parent has experienced violence in their own life, they may have a harder time reacting when their child comes forward. There may be disbelief, there may be the trauma response that kind of makes them not want to believe the things that are happening. And so these are just some of the ways that sexual violence and domestic violence are different. And also when we're thinking about the laws that have pertained to sexual violence versus domestic violence within, broader society, often our sexual violence case, our sexual assault cases are at the felony level, where within many times, a lot of the domestic violence cases that we have seen, at least, within Minnesota and some of the other communities, tend to be more of that misdemeanor, gross misdemeanor level, which creates one difficulty in itself. There's also been, differences in how treatment happens. What sex offender treatment looks like is different than the way the batterer interventions program work, because the underlying root cause can be different. And so we can talk a lot more about these, but we really wanted to name the fact that within programs, a lot of programs are funded to do both. They're funded to do domestic violence and sexual violence, or they're multi-service agencies who tackle a lot more things, or they're based within government, like tribal governmental agencies, such as behavioral health, or within law enforcement or the prosecutor's office, or wherever it may sort of be. And so sexual violence may not be their sole lens. And often you're getting, a single person who is trained on doing sexual violence and who feels comfortable doing that. But within our communities, within any community, that is incredibly difficult to have a sole person who is that go-to. And we know that advocacy is not something that's new within our communities. These circles of support, that go-to, those aunties, those grandmothers, have always been there. And it may not be as formalized as it is now, but our communities are really grounded in supporting each other. And I think that now that when it comes to sexual violence, though, it is still so hard within our communities to be addressing those things. So just want to think again about that impact of sexual violence and how that great impact on the self, whereas there's both the physical impact, your connection to your own body, to your own sexuality, as well as your connection to spirit. I think that is one of the things that we need to, and especially if there are mitigating circumstances or things that have happened where you're placing a lot of blame on yourself, or people externally are placing blame on you, whether or not, if you were drinking, if you were in a situation you shouldn't be, that you shouldn't be, if you were in, all those different things that place blame on the survivor when it is not. People have every right to drink and to not be sexually assaulted, right? But the way that your own mind and your own spirit can frame things, it can splinter. And so then, especially sometimes within our communities, folks who have been sexually assaulted feel that they're not able to then seek out ceremony, especially if they are medicating, like self-medicating with drug or alcohol use. There's been many, ceremonial leaders who won't allow people who are using, to be in those spaces. And then people can even feel more disconnected from community and from culture. We're also thinking about that impact on the community and how both the culture of silence that we often live in, as well as the way that we work with each other and the way that we work with our relatives is just so incredibly important. And we think that how the way that we both our family structure, our friends, if one of us is sexually assaulted and we don't have a good response from, the advocates, from the law enforcement, from the medical providers, from anybody who we try to seek services from, that's going to get out there. People are going to know, and that continued mistrust will keep happening. And we also really want to think about those generations, about how for so long, that intergenerational trauma, thinking about both that we are the generation that can change things, as well as we are the generation that we're being impacted by the previous generations that have happened before us. So. All right, so we've talked about some of these things, but I did want to just draw attention to what makes a response and change within our communities complicated. That intergenerational trauma, I think, cannot, and so, that's stemming both from, boarding schools, forced colonization, all of these other things that have led us to this point where so many of our community members need deep healing, and we often don't have the resources, the time, the ability to really focus on the holistic ways of healing. I think one of the other things that is so incredibly important is how sexual violence isn't a standalone issue. It is linked to housing, know, within many of our communities, we do not have adequate housing, both in terms of emergency shelters or in terms of long-term housing, which can impact people in so many different ways, both before sexual assault and then after as well. When we're thinking about the access to healthcare, as well as to jobs that are paying folks enough. And I think that all of these things are linked. And so even within our own lenses, we have a small portion that needs to be connected elsewhere with these different intersecting issues. Talked about that trauma from and distrust of systems, the jurisdictional complexities, which is going to be unique within each of your spaces. That disconnection from culture. So both beforehand, both because of, you know, the forced relocation of people, the movement to urban communities and back to reservation, or marrying and moving to a different tribe and not having the same access to, you know, medicines and ceremonies that we'd want or need to, as well as, you know, how many folks truly, especially after the boarding schools, have that great disconnect from culture, how culture was weaponized against us, when in fact it is a healing thing and a resilience factor within us. We talked about that discomfort and judgment, and that is coming both from internal things within families, but also within systems providers, and that inability to talk about anatomy, about sexuality, about things that aren't as comfortable. And so, and the big thing is lack of culturally or tribally designed services and resources specific to sexual violence. And I'd say that even within some of our tribal programs, we're seeing that often, you know, especially depending on where they're housed within the tribal government, within the nation, that really shapes the framework. So if they're housed within behavioral health, often we're seeing programs who the only thing that they want to turn to is providing therapy services, right? We also see, you know, if they're within victim services or within, you know, housed within law enforcement, that systems lens is all that they're focusing on. And sometimes those are not always built or embedded with our Indigenous values. And so when we're thinking about how are we writing our policies around sexual violence, both through our program and multidisciplinary or interdisciplinary protocols, how are we making sure that the needs of Indigenous survivors are centered, as well as that our values and access and ways of healing and connecting to each other are embedded throughout our policies, protocols, and practices? I think is incredibly important, as well as often when we're taking policies, protocols, even resources, they weren't designed by us or for us. And so because people are often, you know, one or two advocates for, you know, a whole reservation, people take what they have access to, and they don't even have time or space to always revise it to make it work within your space. And so if you're doing something that's pulled from, you know, mainstream advocacy, it may not always apply to the unique needs of your tribal community. So, and, you know, what do survivors really need? And we're talking about how it is expansive. It is that whole medicine wheel. And I see that so many programs, especially, you know, depending on the funding access that they have, often have this like menu of services that they provide. You know, we can provide hospital accompaniment, we can provide, you know, we can go to court with you, you know, we can do these few things, or even programs who are like, we will see you for 6 peer-to-peer sessions, right? Or all, whatever it may be. But when we really need to be thinking about that whole of the medicine wheel and thinking about how can we have like a comprehensive service plan and ideology within each of our programs, to be thinking about even how does dental care, you know, impact, you know, survivors of violence? How does access to childcare serve as a safety component, right? All of these different things. And so we're also having to pay deep attention to the spiritual and emotional needs as well. Survivors need people with an understanding of those unique needs of American Indian, Alaska Native survivors, including, you know, values and access to culture and ceremony, as well as somebody who understands both the personal sovereignty that comes within our being, that the body sovereignty that we each have within us as individuals, as spirits, as beings, as well as the tribal sovereignty that comes with us being nations of our own. as well as somebody who knows about those current and emerging trends within the movement, and resources both on the local, and that includes tribal, state, within your region, as well as national. And so that's people, you know, such as MIWSAC and the other resource centers, and so many other great people who have dedicated time and knowledge and years of experience. Because I found often advocacy and other things can feel isolating. You feel often that like within your community, it's a issue that you're only facing. And sometimes that can be really embarrassing. I've had communities be like, you wouldn't believe the level of dysfunction that we're having. And I'm like, I believe it because I've seen it in community after community after community. I've also seen the strengths that people are able to have. And so I think that one of the big things that, you know, like people who do, you know, training and technical assistance are able to provide is that normalization of things about how it's not just your community, and we can connect you with folks who may have experienced similar things, or we may be able to share ideas that have worked in other communities as well. And so just kind of before we enter into our listening session, I did want to just like take that minute to be thinking about, like, as we're thinking about the future, as we're thinking about these funds and what we can do with them, in addition to, you know, that great list of things, you know, that is written into the grants and that Shondell had mentioned, but we're really thinking about how can we also have that reconnection with self, with community, with culture. How can we have increased early support for survivors? I think in particular, one of the things that I've seen just the most harm caused is when, you know, we have so many elders within our communities who have never talked about the violence that's happened to them. And I'm not saying people need to share their story or what happened to them all the time. But if you're keeping something in for decades upon decades, it can hold deep within your spirit. And so I think that the earlier we're able to support people, it's all the better, and they'll increases our ability to both have any form of justice, but also healing and having healthier and safer communities. And I think this ability to have this ARP funding, really focusing on, you know, those unique needs of sexual violence is so important, as well as we're exploring these multiple avenues to healing and justice, whatever that may mean within your community. And so I think that at the root of it, we're just planting those seeds to have safer and healthier generations to come. So that was a very brief 101 of me rambling about, you know, the importance of sexual violence, standalone sexual violence, you know, resources, and increasing that knowledge base. And I have done, you know, day-long trainings on these same sort of things. And I know that is just maybe like whetting the appetite, hopefully. But we did want to kind of just take a little bit of time now. So I need to breathe. I just rambled for about 30 minutes at y'all. And I hope you appreciated that. But really the space right now that we're going to enter into, as we kind of do a transition, as we start to, you know, plant our feet on the ground and really just feel connected to, you know, both each other, to the space. We're going to just be transitioning into, you know, a listening session, because this is what matters. It is hearing from you all. Because honestly, most of us, we know about sexual violence when it comes down to it. It's not even necessarily, we don't know the words, we might not know how to describe the best practices or whatever it may be, but within our souls and within our spirits, within our families, we know the great impact that sexual violence has had. And so we're wanting to hear from you today, you know, what are those things that are currently bubbling up? Where are those challenges that you're facing, either within your own program as you're starting to try to explore this more, or when you're working with, you know, the partners and community? Where are those rubs? Where are those things that are awesome, and that you're seeing a lot of headway, and that you're seeing a lot of, you know, change, and the ideas that other folks may be able to, you know, use, as well as at the end of it, you know, like, what else do you need from us? What can we do for you? So I'm going to stop this share. And then I wanted to open it up to you. And so I know I threw a bunch of different questions at you at the same exact time. But please feel free to either, if you want to chat it in, feel free to type things in the chat, or else you can also use, if you want to be anonymous, send it directly to me and I'll read it out, or you can use that Q&A portion, but also unmute and talk. And so please tell me what is happening within your community around sexual assault.
Good morning. I'm Jacqueline Yelch from the Pueblo of Isleta. Thank you so very much for your information. That definitely deserves a breather for a few minutes. So thank you. I'm representing a tribe in New Mexico, and a sexual assault is unfortunately here. It is with adults and it is with children. We are seeing a lot more minors who are engaging in a lot of sexual activities, but it's also coming down to rapes as well. And I know for our community, we recently completed an assessment looking at ACEs and where we're at as a community, and sexual assault definitely is one that is most often suppressed and don't want to talk about it, because when we hear sex, it's not something that we want to openly discuss because it's shameful. But unfortunately, when we don't talk about it, then we get the low numbers of reporting, and we have no knowledge of what to do with services and how to even access resources unless you have somebody fabulous, like some of our coalitions in the state of New Mexico, or any of our other outside agencies that we can turn to, especially our tribal partners. So for us, being fortunate to come across the funding through the sexual assault ARPA monies, we want to build that program here. We want to hear what is happening that we can borrow from that would meet the needs of our own individual community. So we did identify some areas that where we could start. Of course, you know, there's the usual, the direct services, direct funds, you know, to support the client and their need with resources. But really what we're looking for is having a strong foundation to be that source of support for our victims and survivors. So I'm turning to you all to see how we can start that journey, making use of our funding that's available, that's going to be most meaningful, impactful, and that's going to be long-standing, even after the folks that are here depart from the program. So I guess it's a struggle that I see on my end when us as a child protection agency that has the extension of the domestic violence program, we often educate and emphasize the need to report. When we do have our victims and survivors coming forward to report, we're seeing that there is so much disappointment in the legal system, not just when it gets to the courts, but even before it gets there and through investigations. So even building some type of a training, or how can we best build those strengths with these departments that are tasked with investigating these type of crimes, and then having that trickle down effect for direct services and support. How can we work together to make sure that, one, the victim and survivor, they're safe, and the other, that there is justice at the end of the day? Because what we're now seeing is they don't want to come forward to report. And then we end up repeating the cycle, generational, and it's time that we utilize these monies to make a major change in the system that's going to be everlasting. So I'm hoping for some recommendations and how the Pueblo of Isleta can meet that need.
Yeah, I feel that right now I would be doing a disservice, and I really want to connect with you after, if that's okay on that. But yeah, I do think that one of the things that you really brought up that's so important is this idea of that's sustainability, right? And I think what folks will often do within communities is, you know, you'll have this like really amazing training, right? You know, you'll bring somebody in, it'll be a great, you know, all day kind of thing. People will be energized. And then, you know, 6 months from then, especially with the high turnover rates within some programs, a lot of people never attended the training, and a lot of what you learned was never really implemented, right? And so that's one of the things that we want to be, you know, be able to work with people on is, how are you having, you know, from the top down, and that's not even, and from the ground up, that ability to have full buy-in on things, even for folks who, sexual violence, may not be their day-to-day. How do they at least know this, know the bits that they need to know? Like, how do they know what they don't know, right? And how do they know where to talk to or how to communicate with people? And so I think that the idea of sustainability, I think, is so incredibly important. So thank you for that. You see, Kimberly has her hand raised.
Can you hear me?
Yes, we can.
Perfect. Okay. I know for us, we have a lot of issues with like governmental agencies, for example, with our police department. There was an incident between one of our clients and her perpetrator, and it was going to take 6 months to get a police report. Considering like we were ready to take it to court, we hired her legal services, everything was ready to go, and we couldn't get this police report. And we had to keep calling the police and the sheriff's department. We showed up, they couldn't do it in person. It turned into a whole hassle. So I think definitely creating that network with your like police department or sheriff's department, if you're dealing with sheriff or highway patrol, there needs to be consistent training somewhere there, so they understand the severity of the situation.
Yeah, I agree on that. And I also think that so many people have developed so many great trainings out there, right? Where you even have like these online videos and these quizzes and things like that. But there's also sometimes still part of that where I'm like, how the effectiveness of these 15-minute checkbox, trainings that we often get within our communities, and not having that underlying, the shared framework and like the way that people
underlying politics and current.
Yes.
Yeah.
Right. That was what I was. Yeah. Thank you for naming that more directly than I was just trying to be very oblique within certain things. And also, even naming within the community that I worked at, for years and years, it was law enforcement that was pulling, particularly at that point, women aside and sexually assaulting them on the side of the road. Right.
Yeah, it happens.
Even if that was 10, 15 years ago, those people are, all that kind of stuff, that legacy lingers. Right.
Yeah, it does. It's in every aspect of life. And also I've noticed an issue with the tribe. We just had an event and we had this tribal leader speaking, and this tribal leader says, our women need to stand up and they need to, teach the community, teach the kids. And it was interesting because all the pressure was on the females to make everything all right. The males weren't taking their share of the burden that's on them. So we're definitely seeing an issue with that. So we're going to definitely address that next time we have an event and we have a speaker, because that definitely put some people off, that it was all on the women to make it better, not both sexes, 50-50.
Exactly. Thank you so much for that. And I think is it Shania?
It's Shanae.
Oh, thank you.
Hi. Sorry, I'm not going to be looking directly at you guys because my computer's weird. So I just started. This is actually my second week, but already I have a lot of questions. Like, for instance, we're dealing with a sexual assault case, children amongst children, and it just makes me wonder if we've developed, or if we can develop something where we're almost investigating more, like that child who is the perpetrator, were they a victim? Did they not speak out? And were they a victim from an adult? And then it's there's just so much hush hush in our community, and it's terrifying, especially being a mother. The idea that, family members, they'll look the other way, they don't want to expose, and then it's just constantly perpetuated within generational trauma, essentially. And I've also noticed that I'm part of the Muckleshoot tribe, and we partner. We don't have a jail or anything, so we partner with the sheriff department, King County Sheriff Department. And I get worried that people who are coming forward, is it men that are responding? Because if you're a victim, a lot of the time, and it's by a male's hand, you don't want to open up to them, and then if they are being taken down to the station and there's an advocate available, why are we not having advocates from the tribe go with them? Because a lot of these people, they don't understand our cultural background and like ceremonies and things that we do to heal, like sweats and all of that. And so I guess my question is wondering like how, or if you guys have implemented things like that in amongst your tribes to help them be more aligned with like our culture and really helping like the healing process.
I would also love to hear if other people also have follow-up on that as well. And I think that it can be hard. There's some tribes who I think have been really probably putting in the work on things, right? You know, where they've taken that momentary pause, which I think that's one of the things that is so difficult within our movement, within our work, within our communities, is that ability to pause, right? Because with so much crisis happening at us day after day after day, it can just feel like cyclical, like there's no way to like stop. And I think that what sometimes like to that ability to like be okay, like, so we need to rethink what we're doing, right? Because it is so easy to get like systemized, right? It is so easy to just kind of move through those motions. And so I would have to probably think about some examples of communities and ways of, you know, really doing that. But I think that the more that you can kind of take that pause and to look at everything that you're doing, even from like the paperwork. I once worked with a tribe, you know, and I'll mention this probably everywhere I go, but I have this nerdy love of text analysis. I used to work in an organization, you know, where that is something that they were really big on, which was, you know, looking at what we have in writing and what that says about, you know, what we believe, what we do, what we promise and commit to, right? And so I was looking at, you know, their intake paperwork, and it was 18 pages long. And just this idea of having like an 18-page intake where you're sitting there with somebody, and often they were like duplicative because they're like, well, we have like 4 different funding streams and we want to make sure we know this. And I'm just like, how is this really forming a relationship and connection when the first hour you spend with someone is like getting to know all of like what is your social security number, which I don't know why many programs need that. There's probably some reasons why some programs need that, but for that program, I didn't get it. But yeah, so I mean, my way of saying that is just like, once again, I'd love to talk more in the future, but this idea of, yeah, taking a moment to look at, you know, all the policies and thinking about how are those other programs also interconnected to your work, and where are those areas where you have those open doorways, even because let's just be honest, sometimes even within smaller tribal programs, you may have a hard time having meetings with people who are, you know, like a block down from you, right? Where it may be hard to get them on the phone due to their own busyness, the politics that are happening within inner departments, or just who knows, right? So sorry for that non-answer, but so please chat in if anybody else has any other ideas of how people are incorporating, you know, culture within those spaces, you know, that were talked about. And then I think Nicole, yep.
I'll jump in on that one. We used our ARP funding. One of the things that we did is we had a talking circle for survivors, and it didn't matter whether it was childhood, whether it was distant past, if you never reported, we wanted everyone to participate who identified as a survivor. And we used a healing from the trauma of abuse workshop, but we also took the creating a circle of safety from the Grandmothers Council off the MIWSAC resource book. And every workshop we would begin with one of the survivor testimonials out of that workshop. And we would end with a voluntary activity that had some kind of cultural component. The people who participated in our workshops, they said that cultural component is what kept them coming to the workshops. That little, you know, it might have only been 1 page, 3 pages at the most that was part of that workshop, but they loved that part. It touched them, they related to it. And we opened with the one that kind of analyzed what is sexual assault. And all of the participants were like, you know what? I've had a hard time identifying as someone who survived sexual assault because it didn't meet that perfect stranger rape, totally sober kind of a, you know, ideal, but they were survivors. They identified with the stories from the Creating a Circle of Safety handbook more than they identified with the stories of rape from the workshops that were more traditional talk therapy aimed. Another thing is that we do offer that 6 counseling sessions thing. Nobody wanted it. So I went out and I identified a list of Indigenous counselors. I identified non-traditional therapies. We've got, what is it, EDMR. We've got people that offer horse equine therapy, art therapy, brain spotting, all these different forms of therapy, which people were more open to receiving than traditional talk therapy. One participant even said, I've tried talk therapy. I felt judged based on my culture. I couldn't relate to the person. I did not trust them. I did not want to continue going to therapy. So we tried to take that footwork out by identifying therapists that we felt were going to relate to the women more. We made sure they were female therapists. We made sure they were Indigenous. We called them ahead of time to get a feel. Hey, are you going to be a good person to send this individual to? Or are you going to cause more harm? Are you going to judge them? Are you a survivor yourself? So that's something that we've highlighted. And then to address the police, we're having a conference, and the first people I invited was every sheriff's department, every district attorney, every single person who has control over how these cases go. I invited them. I sent probably 750 invites to complete strangers. I'm online stalking just anyone that works in these departments and just mass spamming them with emails, and I'd call them out. This is how you can get to know the needs of the tribal communities that you serve. And that's the key thing. They do serve us. They do serve our organizations. They serve the women that we serve and the men and the children. And they need to know that we're holding them accountable to that. Because there is a history of distrust. There is a history of abuse and targeting. Like someone mentioned, we have a history in Sacramento of our police department targeting women as well, targeting sex workers. It didn't just fall onto Indigenous people, it fell onto anyone who had that intersection of vulnerability. So we're trying to address that. And we're also trying to provide a holistic model of healing. We offer Red Road classes where people can address their addiction. We offer suicide prevention. We offer family strengthening, parental reunification. We're trying to address, because when someone is sexually assaulted, it can cause trauma that disrupts their life. It can cause them to begin having self-destructive behaviors, which may then spiral them into drug addiction, into losing their children, into having an unmanageable life. And by including cultural components to address those, the classes that we teach for parenting and healthy relationships, those are from the Native American Fatherhood and Families Association. So they have that cultural component, and we offer them every day of the month that we're open. So those are ways that we can address the cultural need for healing while also strengthening our community relationships, strengthening our partnerships. And just by trying to address the needs of survivors in a holistic way. Some of the gaps, though, we're not able to access housing. Everyone is struggling with housing in California. When people come through our DV shelter, we don't always have an option for them when their time runs out. And that is the hardest thing for our employees to deal with, is telling someone who's a survivor, you know, our federal guidelines state that we've got to kick you out now. How do you say that to someone? We've reached out to HUD, we've reached out to all these entities. How can we access housing resources? No one can give us a clear answer. I know that there are resources out there. I know that there's ways to put these people at the top of the list, to be able to help them with subsidized rent and other options. But to get our clients on that list, no one can give us an answer. So that is one of the biggest gaps that we've got. And then when it comes to reporting, nobody wants to report. When they do report, it's frustrating, traumatizing process for women who, or people or children who want to get a rape kit done. Some of our tribes are so remote that it is nearly impossible. You know, sometimes the closest rape crisis center is over state lines. Well, if you cross state lines to get your test done, that's interfering with them being able to prosecute, you know. It's just, if you add in the weather and things like that, sometimes it's just flat out impossible. They're not going to physically be able to get to a rape kit center. They're not going to have a cultural component there when they do. I've heard some of the other organizations in like New Mexico that have a SART and an advocate that meet at tribal offices and stuff. I want to know how we can get that. I want to know how we can start getting those programs across our state. Because in California, there's so many tribes. Some of them are so remote. They're, you know, there's mountains in the way. There's closed down highways. It doesn't matter what time of year it is. Some of these places you can't just go back and forth from, you know. So I think that that our organization, we're really struggling with getting the referrals back and forth. Like the rape crisis centers, you know, they don't always call us to let us know that they've got a tribal member who wants cultural support. And then we don't always have a way to connect with the SART nurses ourselves if we have someone that does say they want to. So I think that finding a way to get more SART nurses trained in these different areas to get like grants or whatever to be able to get them to work in these locations. I think that that is definitely something that I would like to learn more about. And if someone else can provide that information, if their program has done so, like, please, I'll put my my email in the chat. And if anyone can reach out to me about it, we would appreciate that.
Thank you so much for that. There's a lot to kind of unpack within that. One thing I will say that, you know, a lot of my past TA work was focusing on sexual assault response teams, particularly in rural areas. And so I do love to always think about those different ways, because yes, while there are so many, you know, best practices, promising practices, things that we know, when it comes down to it, it's going to have to be really unique to each community, right? And especially if we're thinking about, you know, regional, or how we're kind of like embedding multiple tribes, you know, within different spaces. I think that it's difficult and exciting, especially if communities are, you know, primed and willing to be a little vulnerable, which is not always the term that we want to use when we're talking about, you know, folks who are within systems. But I think that there are different ways. And I do know that somebody else had placed within the chat also that that idea that how are we having a good, solid, like medical forensic, you know, response, particularly with and, you know, are there SANEs? And if there's not SANEs, are there other people who are, you know, trained and able and willing to provide the care that folks need? And I think that, you know, I've worked in communities like big and small who have, you know, the response can be difficult to have. And there's also communities where, you know, that medical side of things is leading things, you know. And so yeah, there's a lot. And I'm glad that you put your information in, and people also compete. When it comes down to it, MIWSAC and the other resource centers, we have, you know, a lot of experience, knowledge, all that sort of things, but y'all are going to be each other's best resources at certain points in time, right? Like, you have so much knowledge and expertise, be it this your second week, or if you've been doing this for, you know, 30 years, you all bring so much to the table. And I want to kind of even throughout this process, you know, really be developing those relationships that you each have with each other as well. And so and we did receive a chat also about this idea that how, you know, I've talked a lot, I've been promoting a lot of how are we having, you know, ceremony and culture, you know, embedded within spaces. But when we also really need to address, you know, all the harm that has been caused in so many communities by self-proclaimed or community proclaimed, you know, spiritual leaders and healers, right? And how when those folks who we turn to for trust, to have us help with ceremony or be in relationship with creator or whatever it may be, to treat us the traditional ways, when that is who causes us harm, that can create such a big schism, and it can take a lot, and it is a big issue within so many communities as well. So We have just a couple more minutes, but if anybody has anything else to say, I've been really loving and appreciating this conversation. I'm also going to add one resource for folks, which is something that hasn't come up today, but it's about the financial side of things. And it is about the online learning portal, specifically about these supplemental awards, and some trainings and some videos that can be a help if you're the one who is doing that, or to pass that information along to the folks in your programs who are. So.
Hello.
Hello.
Hi. Good morning. This is Joanne Horn with the Imam Women Shelter in Alaska.
Yes, thank you so much.
Hello.
We can hear you.
Yeah. Okay. Anyway, listening to what you all share, we have that problem too out there, sexual assault going on, and due to lack of police officers in some of the communities, they go unreported, or even if they get reported, it's a waiting process. It's not a quick response. It's really slow to respond to sexual assault. And with the funding we got, sexual assault supplement funding, we're just at a beginning stage on helping sexual assault in our local level. Imam Women Shelter, maybe, I don't know, was asked by another shelter program with a SART team. And I know in the past, before we get a SART, there was a SART, it was kind of like we take care of the sexual assault in our local level. They get reported to the police, and then they get brought to the clinic, and from the sub-regional clinic, they get sent to Bethel or to Anchorage. So, and it's all on weather permitting, because our weather out here has changed so much. And sometimes I could tell you that sexual assault, it took 4 days for a police officer to finally respond, because the recording was on all the police that we tried to call. 14-year-old teenage girl from the local, from the surrounding villages we provide service. Mom was trying to help her daughter make a report. It took 4 days. But anyway, she got taken care of. And another thing, you guys, I have another, I wanted to ask if there's a sexual assault policy, or is there, do you guys do policies on sexual assault?
Yeah, thank you so much for sharing that. I think that, so many of our communities have those different ways that can really cause slowdowns and delays within the response, in addition to the human side of things. But when we're thinking about, as somebody mentioned, having mountains, like where your shared geography is at, and how the impact of weather within spaces, and how can we help to account for that. So just thank you for bringing that part up. When it comes to policies, we have worked with, particularly under, one of our other grant funds, which is a TSAS fund, worked with folks on policies. And under the Resource Center, we are hoping to be increasing our number of like model sorts of policies or samples for folks, which I truly think that no matter what, like I don't believe in people taking, this sample that's out there and just, switching the names within it, but just a baseline for people to start to have those conversations about how you can have a policy that works for your community as well. And so we have some currently, but we are hoping to grow and to expand on things like that as well. So just why we're excited about this resource center. Yay, allowing us to do all the things as well. So we are coming at time here pretty soon, and I do see some good things going on in the chat as well. And I think there are so many ideas out there, both for us to be thinking, both the direct ways that have kind of been named within the funding, but also thinking, that creative and expansive way about how are we best meeting those unique needs and challenges, within our communities and focusing on some of these things. And how are you also prioritizing stuff? That's one of the, for me, the big things where sometimes when we have these conversations, we're like, oh, we have to tackle youth and medical and this and that all at the same time, and really helping to like pause and think about how we're prioritizing and how, if we can get this one portion done, will that maybe help us and build momentum to create, other changes within spaces. And so I think that that's also something that we are always willing and wanting to talk about, is how do we strategically think about where we prioritize our time, right? So please, if there's anything else, please keep chatting things in. I did also want to name that one of the things that to be on the lookout for is we're going to be starting to do office hours every month. We're crossing our fingers that the whole first one of these office hours will be at the end of April, which is Sexual Assault Awareness Month, as many folks probably know. And so, yeah, so to be able to have this time to actually, dive deeper into the TA sort of side of things. This was mostly about, us listening. So I feel like I did not give all the answers because some of these answers will take very, very long time. But this has been absolutely wonderful, being in space, and, like Chimagwich to everybody for sharing their hearts, their communities, the stories, the good and the bad. And so I really just want to thank you all for this opportunity to talk with you today. And I'm going to turn off the recording and then we can do our more official goodbyes, less official goodbyes. I don't know which one.